flow into the area and relieving arthritis and some other conditions. So that's an IOI claim, or we call it Class 3A lasers. All right, here is NHN under FDA. NHN is the approval given to Microlight laser because it was the only laser that did medical double-blind studies. And so the classification and clearance was they were approved as a laser with medical double-blind studies indication wrist pain associated with carpal tunnel syndrome, and then a year later they also got approval and clearance on arthritis and joint pain. And that's an NHN approval. Here are some of the IOL companies that you're probably familiar with. Dodtronics, they're all actually LEDs. Dodtronics uses only LEDs. Chattanooga has a combination of some laser diodes, but mostly LEDs. Mettler, the same way. Anodyne, the same way. Vinci is a Class 4 laser, and they go up to 10 watts, and so they're Class 4. Richmar is another one. They also use LEDs, Cherquant, Multiradia, and Apollo. All of those companies have one thing in common, except for Vinci. Vinci is a Class 4, is that they use LEDs on the bottom of their device. And you may see a few laser diodes, but you will not see much else with that. We did two double-blind studies with General Motors and Baylor College of Medicine. There was a protocol written for pain management, soft tissue trauma under FDA that included 36 different conditions and 300 investigators. And so we discovered General Motors in 1993. They were having problems with carpal tunnel syndrome. That was their biggest work comp problem. And so Microlight actually joined General Motors in Flint, Michigan with their medical group. And the protocol was written for the lasers to be used on employees at General Motors. So they bought 15 lasers and were approved under IRB board that was approving all the doctors under the study for FDA. And once they were approved, they started using lasers. So they treated over a 2-year period in excess of 10,000 workers for carpal tunnel syndrome. And at the end of 2 years, they had such great results, they decided to fund a double-blind study to prove that the laser worked. So what they did is they selected 119 workers, all on disability for carpal tunnel, and included a baseline of their baseline as far as blood flow through the wrist. And so they included a non-invasive Doppler ultrasound that measured very specific blood flow through the wrist. And the protocol was written for physical therapy in both groups, and also they included a laser, sham, and also a live laser. There were 2 lasers, both were Microlight lasers. The sham laser had its circuitry disconnected. Nobody knew which was live, which was sham. And the protocol was, again, 3 times a week for 5 weeks. And at the end of that time, they summarized all of the data, and they went public with their study in spring of 1995 in Detroit. And they started presenting their study on the use of the laser for carpal tunnel syndrome. And the results were, with physical therapy alone, they had over a 36% improvement in range of motion, but when they added the laser, it went to over 75%. So the range of motion was almost doubled compared to just physical therapy alone. Also, they had an increase in the flow of electrons up and down the nerve sheath. So there was an increase in nerve conduction as well as range of motion in the study. And this study was published in the Orthopedic Journal August of 1995, and the name of the journal is SPIE, S-P-I-E, and you can certainly look that up and you'll see the entire study. And we also have it available on PDF file if you're interested in receiving that at the end of the webinar. So that was the first study. That was General Motors. FDA looked at the study and they said, we see this, but we want to see more studies. We want to see a second medical double-blind study. So second one was done at Baylor College of Medicine in 1999 in Houston, Texas. It included the professor of orthopedics at Baylor, also done on carpal tunnel syndrome. The group was 140 patients that you probably would see in your normal practice. And again, the same parameters, same baselines were done. The protocol was written, it was 3 times a week for 5 weeks. And at the end of that time, they also presented their findings, and they also had a 75% improvement. So based upon the 2 medical double-blind studies, FDA issued a clearance letter, a letter to market, to Microlight laser on February the 6th, 2002, and it was approved as a Class 3B laser, first one in the world. And the indication was wrist pain associated with carpal tunnel syndrome with medical double-blind studies. And so that was the first laser approved in the United States, the first one to go through FDA, and the first one approved. So that's some of the background on the medical double-blind studies. Some of the world literature at that time, both in Asia and Europe, had indicated that there was some very good evidence that the wavelength 830 nanometers operating between 60 milliwatts and 90 milliwatts was an ideal condition to reach the deepest penetration and also to have the least absorption of light. These lasers, photolasers, are all about absorption of lighted tissue. So Microlight actually found this 830 nanometer laser. It was being manufactured in Denmark, and this was in early 1991. And so they selected that as the method of they wanted to use in that particular wavelength based on world literature. And so that's how the ML830 came about. So Microlight bought the laser, brought it to the United States. It spent the next 12 years going through FDA, and the result are these 2 studies that we're talking about. Now, as far as use of the 830 in Asia and Europe, it had been documented over a 20-year period of time that this was the one. There was a window of opportunity that had the least amount of absorption of light in the hemoglobin and myelin, or blood and water, down to 5 centimeters. And so, again, this was confirmed in 12 years worth of studies with General Motors, Better College of Medicine, and 300 investigators. Okay. Laser benefits. So here are some of the benefits. It's biostimulation, photobiostimulation, so they call it. Increased blood flow, basal dilation of the blood vessels. Ischemic injury increases blood flow. And what happens with the way it actually works is light penetrates down, absorbed in the mitochondria of the cell. First thing it does, it changes pH balance from acidic to alkaline. The second thing it does, it starts dividing the cells. And then it increases production of ATP, which is the fuel for the cell, and also the production of nitric oxide, which expands the blood vessels. In addition to that, you can see all these other different conditions that are part of what they call the anti-inflammatory response. Some of the other things that they're used for wound healing is there's a couple of studies that were done. One in particular study was done in 1995 in Houston at a hospital in the medical center in Houston on treating wound management, and it was done double-blind, and they had very good success with it. What they found was the use of the laser actually healed up, basically it had a 50% increase in the healing of wounds and burns, cutting the healing time in half by basically dividing the cells and increasing nerve conduction and nerve production. So it was shown to be very helpful in the use of lasers for wound management. In addition to that, again, there was also some evidence on General Motors that it also improved the flow of electrons up and down the nerve sheath. So there was a new nerve regeneration, and that was also shown in the study of General Motors. Counterindications. During the study for the FDA, Microlight took all the counterindications. To begin with, pregnancy was one of them. Cancer was another. Pacemakers was another. Metal implants, thyroid disease, and the possibility of eye damage. So all those conditions were considered and were part of the FDA study. At the end of 12 years and the approval by FDA, the only counterindication that was approved was for use in the eyes. If you showed it directly in the eyes over a period of time, you could have slight damage. They recommend that you not treat over the pregnant uterus. You can do any other area of the body. It's not a problem. Cancer, The literature is still divided on cancer. 50% says that it does affect cell growth. The other 50% says it doesn't. So it may be a risk you may or may not want to take. Thyroid disease, do not treat over the thyroid at all. You can treat any other area of the body. And there's no problem because this laser does not generate heat or electricity. Safe to use around metal implants and pacemakers. And at this point in time, there's probably been in excess of 15 million patients treated with a microlight laser over the last 20 years, and not one single report of ever harming a patient. So you cannot overtreat with a laser, and it's safe. Okay, here's the Microlight laser specifications. You can see it's a Class 3D laser, 830 nanometers, 90 milliwatts of power, and patented. And I want to speak for a minute about the patent on the laser. In 1995, Microlight decided to actually file for a method patent on the laser. And the reason they did is over a period of about 12 years, they spent in excess of $4 million going through the FDA, and they wanted to protect their investment, so they got a patent on it. Now, you can't patent light, but they did a method patent. And the method patent said you cannot treat a patient between 800 and 830 nanometers at 90 milliwatts of power. That's the patent. So this was before FDA approved the laser, which was 2002. But knowing that as soon as they got approval by FDA, there were other companies coming in from Europe and Canada, having easy access to the market, piggyback on some of the research, and that's exactly what happened. There were probably 10 or 12 companies that came in under an IOI claim, under this claim with LEDs as a heating device, except they made the mistake of copying the wavelength and the power. So Microlight ended up going to court, sued them, got damages, and they all pulled out. So that's why you will see, if you're looking on Google, and you'll see a lot of the different lasers have wavelengths anywhere from 785 to 985 to 903 to whatever. And that's the reason that they're all over the place, is because they got out of that space of the patent. They did not want to be part of the lawsuit. So they agreed to get out, and so they did. They went to different wavelengths, none of which have any studies that say they work. And again, all these companies were approved under what is called an IOI claim or heat claim. Okay, so Microlight, as you can see, goes down to a depth of 5 centimeters. It hits the cell, spreads out laterally 3 centimeters, 5 centimeters deep, and that proves the depth of penetration. So it's a tight band all the way down to the cell, and so you can reach roughly 2.5 inches. If you wanted to go deeper, you could press a little harder against the skin, and this would go down to even over 3 inches depth. Okay, it works great on myofascial pain, works great on fibromyalgia and other conditions. On the right, you'll see one of the lasers. This is the Microlight ML830 DC Direct Connect. It's a laser that came out about 4 years ago. There's also a battery-operated laser. So there are 2 lasers. One plugs in the wall. It's the DC model that's shown here. And at the very end, we'll show you the other battery-operated laser. So we'll talk about the different lasers at the end of the webinar. Okay. History of Microlight, the ML8